Dear students and my teacher friends, Namaskar. I welcome you to the presentation lecture on diabetes. Now, here in this topic, uh, I'm going to make a brief discussion on diabetes. Now, you can understand there is so much detail, and there are various type of diabetes as well. So there is so much detail in this topic, but keeping in mind the depth of your syllabus, I will discuss this topic with you briefly. Okay, so now starting with the first point. Okay, so first of all, what is diabetes? What actually happens in diabetes? So first point, diabetes is any metabolic disorder resulting in chronic polyuria. So diabetes is a metabolic disorder from which result in chronic polyuria. Now what is polyuria? So let's try to understand polyuria. See, urine volume. Okay, an average adult person uh, an average adult person produces 1 to 2 liter of urine per day. So normal person urinate urine, and the volume of urine is generally 1 to 2 liter daily. Okay, and if the volume of urine per day increases more than 2 liter, that means if urine output is greater than 2 liter per day, that condition is known as diuresis or polyuria. Okay, so what is polyuria or diuresis? Urine output is greater than 2 liter per day, that is known as diuresis or polyuria. Second point, there are at least 4 forms of diabetes, and these 4 forms are: first form, diabetes mellitus type 1; second form, diabetes mellitus type 2; third form of diabetes, gestation diabetes; and the last one is the diabetes insipidus. So we are remembering this. There are 4 forms of diabetes: diabetes mellitus type 1, diabetes mellitus type 2, gestation diabetes, and the fourth one, diabetes insipidus. Now, in most cases, the reason why polyuria is occurring, so polyuria result from high concentration of glucose in the renal tubule. Okay, more amount of glucose is present in the renal tubule fluid. Now, what this glucose is causing? So this excessive glucose retains more water in the renal tubule osmotically. So due to osmosis, this water remains with the glucose in the renal tubule, and this water is not going to absorb by the renal tubule. So water is not entering in the peritubular capillary, so water is not returning in the body. So we can understand now, as the more water is present in the renal tubule, so finally this water is going to pass in the urine. So when the patient urinate, more amount of water is lost. This condition is known as osmotic diuresis, and as the water, excessive water is lost, person may become severely dehydrated. Large amount of water is lost from the patient body. Okay, so this is about polyuria and why this polyuria is occurring. Now, in diabetes mellitus and gestation diabetes, what happened? there is a high glucose level in tubular fluid. And the reason high glucose is present in the tubular fluid is that it is the reason for this is the hyperglycemia. So due to the hyperglycemia, and what is hyperglycemia? So high level of glucose in the blood is known as hyperglycemia. So as large amount of glucose is present in the blood, due to that, when glomerular filtration process is taking place inside the kidney, that time in the filtrate high glucose is present, and in the filtrate high glucose is present, that means in the tubular fluid high glucose level is there. Okay, so this is what happens exactly in the diabetes mellitus and gestation diabetes. Now, 1 to 3% of pregnant women experience gestation diabetes. Now, what happens in gestation diabetes? See, due to the pregnancy, the pregnant lady or the mother's insulin sensitivity reduces. Okay, so pregnant woman become less sensitive towards the hormone insulin, and as the sensitivity for the insulin is reduced, the pregnant woman suffers from hyperglycemia and glycosuria. So what is hyperglycemia and what is glycosuria, that we are going to discuss in the last paragraph, in the last point. Okay, so once again, what is diabetes mellitus and gestation diabetes? So due to hyperglycemia in the tubular fluid, high glucose level is there, and the reason for this, so when the glomerular filtration is taking place, more glucose is there in filtrate, so that means more glucose is there in the tubular fluid. The reason is hyperglycemia, high blood glucose level. And during pregnancy, the insulin sensitivity is going to reduce, and due to that, the pregnant woman suffer from hyperglycemia and glycosuria. Now, diabetes insipidus. Okay, so diabetes insipidus result from ADH hyposecretion. If less antidiuretic hormone is secreted, that will result in diabetes insipidus. Now, what happens in diabetes insipidus? So, as ADH is absent, or there is a reduced level of ADH, due to that, collecting duct does not reabsorb much water. So that means in the renal tubule fluid more water is present, and this water passes with the urine. Okay, so more water is lost. So when the person urinate, excessive amount of water is lost. This is exactly what happens in the diabetes insipidus. So for diabetes insipidus, we are remembering that it results from the hyposecretion of ADH. Without the ADH, collecting duct does not reabsorbing much water, and patient when urinate, the patient expel more water in the urine. Now the 6th point, diabetes mellitus and gestation diabetes are characterized by glycosuria. Then the 7th point, see, before chemical tests for urine glucose were developed, physician diagnosed diabetes mellitus by testing patient urine for sweetness. Now we can understand this thing that nowadays, there are so many chemical tests are available. If you are a class 11 or by 11 or 12 biology student, so in the laboratory, you can simply perform the test for glucose in your biology lab. Okay, so it is a very easy, and So here they are talking about the earlier day, how in the earlier day the physician or the doctor were able to diagnose that the patient is suffering from the diabetes. So during during those days, in the earlier times, see, the the physician, they were just running uh, uh, this urine, they were just spreading urine in the room, okay, in one corner. And once the urine of the patient is spread at one place, so if the insect or the ant, okay, so if the ant or insect, if they are attracted toward this urine, so they diagnose that this patient urine is having a presence of glucose, okay. So this was the ancient method, we can say, so by which the physician were diagnosed. But now this is the old period time when they were using this ancient method, but now there are so many modern technique and tests are available to check the glucose level, okay. Now the test for glycosuria are now as simple as dipping a chemical test strip into the urine specimen, okay. So nowadays what how we are checking the glucose level is that, first of all, in a container the patient urine is taken and a chemical strip is dipped into that patient urine, and if the color of the strip is changing, so by the intensity of this change in color, the amount of glucose is determined. That means how much glucose is present in the blood, okay. Now, an advance in medical technology for which urologists are no doubt grateful. So the meaning of this line is that, see, nowadays there are so many patients, there are so many people are suffering from this disease, diabetes, and we know many of them are not visiting the pathology lab for the test of diabetes. Now, at our home, the simple kit for the diabetes is available. So, in that, we know normally a simple puncture is made on the finger and the blood ooze out. Okay, so this blood is used for the so one strip is applied on this blood, and the second portion of the strip, we know, is connected with the small machine, and in the machine, that small machine shows us the digital number, okay, what is the level of the glucose in the blood. So we should thank for this advancement in technology. So we should be grateful, we should be thankful to the scientists, to the urologists, for developing these instruments, okay, so by which we are able to find the glucose level in our body very easily. Now, in diabetes insipidus, the urine contain no glucose, okay. Diabetes insipidus, the urine contains no glucose, and by the old diagnostic method would not taste sweet. So here in this case, the ant or the insect, they are not going to stick with the patient's urine, because in the patient urine no glucose is present. Now one more topic, glycosuria, we are going to discuss. See, if too much glucose is present in the filtrate, So this filtrate is going to enter in renal tubule. So the renal tubule fluid is containing high glucose, okay, and as the level of glucose is very high, so this glucose is not going to reabsorb, okay. So the glucose is present in the renal tubule fluid. So when the urine is formed, this glucose is going to appear in the urine, and this condition is known as glycosuria. So once again, what is happening in glycosuria? There is too much glucose present in the filtrate, so this glucose is not going to reabsorb and glucose is going to appear in the urine. This condition is known as glycosuria. Now glycosuria is commonly seen with the disorder diabetes mellitus. So patient suffering from diabetes mellitus, in this patient's urine there is a presence of glucose. So that means the patient, diabetes mellitus patient, also suffering from glycosuria, there is a presence of glucose in patient urine. Now what is the reason for this diabetes mellitus? So diabetes mellitus is a condition characterized by defect in the production of or response to the pancreatic hormone insulin. So the patient who is suffering from diabetes mellitus, in the patient body, the pancreas is not producing insulin. That is one situation or the condition. And the second thing, a patient is producing insulin, but this insulin is not effective in patient body. So these are two different things. Patient is not able to produce insulin hormone, or the insulin, he is able to produce insulin, but the insulin is not effective one. So now what happened? See what insulin, what role this hormone insulin is playing in our body. See, insulin causes most of our body cell to take in glucose, okay. Insulin affect on body cell, and due to the effect of insulin on our body cell take glucose, okay. Now if insulin is absent, so the cells of our body, they are not going to absorb glucose, so glucose is not going to enter into cytoplasm or the cytosol. And as the glucose is not entering in the cytosol, what is going to happen? So glucose, that means glucose is going to remain in the blood. So that means the high level of circulating blood glucose will be observed, and this condition is known as hyperglycemia. So why the hyperglycemia is resulting? The reason is insulin is not affecting the body cell are not uptaking the glucose is not entering in the cytosol of the body cell. Due to that, the level of glucose increases in the blood. This condition is known as hyperglycemia. Now as the patient is suffering the hyperglycemia, so when the blood entered in the kidney, okay, and when there is a urine formation is going to take place, so we know the first step in urine formation is glomerular filtration. So in the glomerular filtration process, when the filtrate is produced, in that filtrate excessive amount of glucose is present. So this filtrate is going to enter in the renal tubule, okay. So in the renal tubule, high glucose level is there, okay. So now finally when the urine formation, so this excessive glucose in the renal tubule fluid is not going to reabsorb. So that means the glucose is going to remain present in the urine, okay. So when the patient urinate, that time glucose is present in the urine. This is hyperglycemia. So with this we have discussed all the point, okay. We have discussed now you know what is glycosuria. We have discussed diabetes mellitus, we have discussed hyperglycemia, we have discussed diabetes insipidus, okay, gestation diabetes, okay. So once again, I am showing you all the theory point. So 1 to 9 theory points are there. Let me show you all the theory points. So these are 1 to 6 point. Point number 7, 8, 9. Okay. To 6. So with this we have completed this lecture on diabetes. I hope you have enjoyed this lecture, and I also hope that this lecture will be helpful in your exam preparation and also in your studies. My name is Manish Kushti sir. I am from Ahmedabad, India. Bye bye. Namaste.